So you're very welcome, everybody, to the University of Warwick MSc in Diabetes Care Information Briefing Session. It's lovely to have you here this evening. And congrats to all our English on this evening from last night. It was a brilliant celebration. So it's lovely to have you here. And this is the running order for today. We will be talking to Joanne Walsh, who is one of our current students on the programme. We're just finished, she's just about to start the MSc stage. Diarmuid will be talking to her, and he's head of our academic affairs. And then we will go into a presentation from Dr. Colin Kenny, who is the programme director on the programme. And then we will finish with the overall programme overview by Diarmuid, the presentation about the general just the general Q&A and FAQs about the programme itself. And then the real end, we'll open to a broad Q&A from yourself and answer any questions that we haven't answered in the chat. So we'll try and keep it within the hour because we know you're very busy. And without further ado, I'll hand you over to Diarmuid and Joanne.
Great, thanks a million, Rebecca. So as Rebecca said, I lead the academic function in IHEED, and effectively I'm responsible for all of our education delivery. Delighted to be here tonight and delighted to have Joanne with us. We've gotten to know Joanne over the last year as one of the participants on the programme, and just finished the Postgraduate Diploma a few months ago and about to start into the MSc now. Joanne, do you want to just introduce yourself and maybe tell the people on the call tonight, you know, why did you choose to do a qualification in diabetes?
So as Diarmuid said, my name is Joanne. Hi, welcome everybody. I'm actually a nurse. I'm a practice nurse. I currently work in a GP practice. My background, I originally started out in the emergency department. So I did a couple of years, and I've also worked in an acute surgical ward and in respiratory. I suppose a couple of years ago, I decided I just wanted to go down the route of taking on a nurse specialist role. And because I kind of had a broad interest in lots of different things, I kind of researched to see what would be of interest to me. I quite like something that's quite clinical based. Or at least kind of gets you to think with a few puzzle pieces put together. I had actually Facebook has benefits. I stumbled across an advert for the programme on Facebook. I clicked on learn more, and I suppose the rest is history, so to speak. I embarked on the programme, as Diarmuid said, a couple of years ago. So I suppose initially my interest was because I wanted to develop professionally, and I wanted to enter into a role that I could possibly explore in a nurse specialist capacity.
And how did you find returning to study? You know, the average age on this program is late 30s, early 40s. How did you find, you know, getting back into things like academic writing, to having a study schedule or a rhythm? How did you adjust?
I suppose the hardest thing for me, I'm kind of the running joke in my family because I'm kind of the endless student. So I've not really had too many long periods out where I've been out of academia and, you know, much to my pocket. But I suppose what was different for me was that even if you've had a period of time out, you know, it's about getting back into it and reintroduced again. I suppose for me, there was a lot of education from the programme itself with regards how to deal with that type of, I suppose, you know, people might be a bit reluctant or kind of concerned that they wouldn't, you know, they would not be able to do academic writing. But there's lots of support on the programme. There's lots of kind of talks, and it's addressed obviously in the programme, and there's a lot of support there. So I suppose from that point of view, it helped kind of bridge the gap with regards to academic writing and things like that.
And how about the online piece? I mean, we're very conscious that everyone on the program is a full-time clinician, a part-time learner, you know, everyone. And when you think about kind of an old style traditional distance learning program, you know, that, I don't know about anyone else, but that kind of fills me with horror, because you get this image of someone kind of very much alone in their study. How did you find kind of the group that you were with, and I suppose, did you build camaraderie with other people that were in your group, with your tutors? How did you find kind of the personal online experience?
I suppose it's, if you know, having come through the program, it's probably one of the things that I would say that the program is quite excellent and excels in. I suppose from the point of view with regards to, in the first group that I was part of, we developed a WhatsApp group, for example, and we'd often share articles maybe that we would have read that might be useful, or if we know, even if somebody was running late to a tutorial, they might say, oh, can you pop it in the group, and we share it like that. I think there's lots of opportunities to create discussion groups within the actual program itself. But from an online perspective, as you say, like a lot of us would be used to traditional ways of attending university, physically being in lectures and things like that. For me, I've studied quite a lot, and I have to say it's probably the best program I've participated in from that context, because it allows you to build the program around your own personal life and not you around it, which works if you're a mom like I am, if you've kids like I do, if you've a full-time job like I do, and especially when we went through COVID as nurses, any nurses on here will know how hard that was. It was just so amazing because you were allowed, you could and had the capacity to do well, but still be able to participate in the program because you were able to work it around your agenda. And online allows that hugely. Plus, you don't have to go to a library. Everything is available to you online, through the program, through the platform. And I just felt that if you're a working mom that has a full-time job, it really is ideal. And that's what I thought was the most best part for me, was the fact that you could do things online, and it was online, and I didn't physically need to go to a lecture or leave my house. I could just pick up my laptop when I had time during the day and sit down and do the work I needed to do. So it really works for me.
You summed it up brilliantly. And I think the bit that has amazed us is that over the past year with COVID-19, that we haven't had a fall off in pass rates. We haven't had a fall off in attendance rates. It's been phenomenal, the degree to which I think people have actually enjoyed doing something other than COVID. We have the height of respect for the people that have come through the program in the last year and a half. It's been amazing to watch. But you're right, that support network, be it from within your own group, be it from the tutors, be it from the guys actually kind of managing the program, I think it's crucially important. In terms, and I'm conscious we could chat all evening about this, and hand over to Colin shortly, but in terms of patient care, has it actually, you've done the taught part of it, you've done the modules on the diploma. Has it affected how you are managing people with diabetes?
Absolutely. I think as a nurse, having not had a strong background in diabetes prior to starting the program, I was very much used to just administering insulin and being directed with from other professionals that were obviously specialized in that field. Since I've obviously, I made the personal choice to move out of the acute sector and into primary care, because I wanted to be able to utilize the knowledge that I was learning. I suppose I've never looked more consciously at people's feet, number one. I wouldn't have been overly bothered, and like people take their shoes off in my surgery and I'm looking at their feet they might not even have diabetes, and I'm looking at their feet and I'm like, or like I'll sit down and look at their medication and I'll put this was what I was saying about the pieces of a puzzle for me. It's not just about looking at their HbA1cs or their sugars. You have to look at other bloods that are relevant to obviously diabetes. You have to look at their urine. You look at their feet, your eyes, what retinopathy screens they've had. And it's about being able to put all those pieces together. And 2 years ago I wouldn't have been able to tell you anything about that. Now I can actually do a diabetic assessment on a patient. I can look at their medication, and I've actually made a suggestion to a GP about what medication. They asked my opinion actually about what medication did I think was suitable for this particular person. And they're the ideal patient. They don't have any renal problems, cardiac problems. So my favorite is the SGLT2 inhibitors. And I said, oh yeah. She said, and I really felt like, what, it's the first time I've actually felt anyone's valued my opinion, and I actually had an opinion to offer. And I felt like I would never been able to do any of that prior to the course. So from somebody who never had a diabetic background, that would probably be another plus side to me, that I would now be confident in being able to look at a diabetic person and look at them holistically, as opposed to just giving them their insulin. So
that's you've hit the nail on the head. I think from a personal development perspective, that's amazing. But actually, from a health system perspective, you want nurses in primary care managing far more of diabetes. You want the people in family medicine in general practice managing more of diabetes, so it's not clogging up the hospital system. You want to get this into the community as much as you can. And the when we speak to alumni from that are medical, that the doctors coming off the program, what they're saying is, they're kind of hunting out the complex, challenging, and difficult diabetes patients, because they're now known as, they're the go-to person for diabetes. And that, from kind of almost avoiding that level of complexity to wanting the challenge of, I can do this. It's an
kind
amazing
of
transition.
I think so what's inspired me to continue on to this promotion when it comes to diabetes, and how much there is a huge value in that, in trying to help reduce the incidence of younger people developing type 2 diabetes. And I bang on about it. My family are like going, I'm nearly watching what they're putting into their mouths, and they're like, oh. And so for me, like, it's given me a new sense of drive. It's given me a new purpose about being a nurse. And I feel like that, whereas you don't always have to be in a hospital and by someone's bedside to make an impact. And for me, that's kind of where I'm going to go with my MSc. I'm hoping to try and, on an educational basis, trying to make an impact with regards to the future of diabetes, as opposed to trying to tackle problems that we experience right now. So for me, I actually couldn't say enough about the program. I was a bit dubious. I was thinking, how's this whole online business going to work? But like, you know yourself, and I have been through ups and downs over the year, and the support I've received is absolutely phenomenal, thanks to both yourself and to my best friend Ian. I wouldn't have made it through the program. So for me, it was a win-win all round. And I'm not one for kind of ever really, like, you'd really want to be impressed for me to be promoting. And it has hugely done a lot for my self-confidence. I went through a really bad personal experience nursing. I almost gave up nursing like about 6 months before I took on the program, and it's just given me a newfound purpose in nursing. And I just feel like I probably was meant to stay in nursing for a reason, and it's kind of tick the boxes for the challenges that I want to get out of nursing too. And for those who are kind of thinking, oh, I don't know if I'm going to be able to, I didn't have a diabetic background at all going into this program, and I found it very manageable, and I found it very easy in the sense that nothing was overcomplicated, and there was always support at hand whenever I hit a snag in something. So for me, it was a win-win all round anyway, and delighted to share like my positive experience with everybody in the group as well.
I was going to say, Joanne, whenever we ask somebody to, one of the current students to come on to the program and speak about it, they are generally enthusiastic and positive. But I think that is that level of impact is phenomenal to hear. It's amazing. So thank you so much for sharing all of that.
Thank you too. Thank you for being there for me too as well. So I'm very grateful likewise.
Brilliant, guys. I'm conscious of time. Rebecca's going to beat us if we don't move on. So.
Thanks, guys. That was amazing, Joanne. I really appreciate your input.
No problem at all.
Just before we go any further, I'm just going to launch a very quick poll, guys. It'll just run for a couple of minutes, so it won't take much of your time. It's just to get a deeper understanding of your rationale for attending the webinar this evening. So it's launched now. It should just take a few seconds. So we usually get in the 60 to 70% response rate. So if you don't mind, that'd be brilliant. And it helps us tailor our response to you post webinar as well. And it's just very interesting to see what level of qualification you're interested in as well. So it won't take long. We always joke and say we should have some elevator music playing now with the polls on. Because they can get a bit boring to look at, but we'll try and get through them as quick as possible.
Promise we'll have music for the next one.
Say it again, Jim.
I said I promise we'll have music for the next one.
Really? Play the guitar.
And down music, Dermot.
It's around 58% now. Thanks, guys. We'll just go a little bit further and we'll stop it because I don't want it to interrupt. We're trying to stay on schedule.
approaching 70%.
Thank you. That was wonderful.
Okay, will we hand over to Colin?
Absolutely. Thanks. This is Dr. Colin Kenny, who's the director of this program. So we're delighted to have him here with us tonight.
Folks, I hope you can see my screen. That's me. Joanne, thank you very much for that testimonial. I enjoyed teaching you about a year ago now, and I'm so pleased that you've done so well with the course. This is me. I've been a family doctor for over 30 years, but I'm also the course leader in the Diploma Masters. Very pleased to be that. I've had a very enjoyable couple of years as the course leader. Tonight, I'm just going to quickly give you a course overview. Together, we're going to look at the world of diabetes. I'm going to talk you through the key course content, and then I'm going to give you a quick update in diabetes because you've joined a diabetes program tonight. I want to give you the flavour of the course. We have a curriculum-based course. It follows the International Diabetes Federation curriculum. We do cover type 1 diabetes, but principally type 2. We have now got a faculty of really experienced tutors who are practical as well as academic. We tend to focus on what's important in your region. It's the UK and Ireland tonight, but we teach in other parts of the world. We do cover modern management. We talk about individualising care, and we give you important updates and guidance. It is, as Joanne told you, an online format. It's flexible to your work, as she told you, so you can participate from your office, but more commonly your home. And we have a weekly recorded tutorial similar to this. In fact, I've just finished one this evening. So let's think about the world of diabetes. Well, first of all, this is a leading article from a couple of years ago now. Diabetes and its driver, the largest epidemic in human history. Very striking when I first read this, but of course, as you know, what has happened in the last 18 months is that COVID-19 has come along, and so therefore we have the interaction of two pandemics now. But it's also worth observing that people who have diabetes and it's well controlled are much more likely to survive COVID than people with poor blood glucose control. And I will come back to that shortly. So here's some stats for you. Worldwide, we've got 463 million adults living with diabetes. Many of them are low and middle income countries. 1 in 5 of people over 65 have diabetes. In all healthcare systems, about 10% of spending. Children with both type 1 and more critically type 2, we've got 1.1 million of them. And then, of course, when it comes to pregnancy and live births, that's a big factor as well. And this is IDF data, and we'll be directing you to this because it's our go-to resource for global data. Global inactivity is a big driver of this. There's a vast range. So I do teach Kuwaitis, and they do tell me that, yes, they're a very inactive nation. We had a Ugandan student, and he tells me that they are very active. But there's a big spectrum in between. In the UK, about 40% of us are totally inactive. So let's look at the key course content here. First of all, Module 1, we cover diagnosis. We tell you why it's a line in the sand, and that line in the sand is at 48 or 6.5%, and we tell you why that is. We do follow, I know there's NICE and SIGN guidance in the UK and Ireland, but actually we do follow ADA guidance because they update it every year. This is this year's update, and that's what we tend to follow. And I'll show you shortly the ADA algorithm that we use. And that's in Module 2, because in Module 2, we teach medication. Everyone starts with metformin, but we tell you where to place those other 4 agents as well and when to use them. And of course, we cover injectables, both insulin and GLP-1s. Speaking of injectables, insulin's 100. It just turned 100 a couple of months ago. Fantastic discovery, insulin. It's a very moving story if you're like me and have a daughter with type 1 diabetes. It is life-saving. But of course, there's barriers to insulin injection. Many of you will find patients who are worried about insulin. We'll tell you what those barriers are. But really, very simply, insulin is the right people, the right insulin, the right dose, the right time, the right strength, and the right device. Very simply, and that's it in a nutshell. And we'll be teaching you a lot about that. And of course, where the other drugs work as well. Of course, you would expect that in a course like this. There's a complex slide. I'm not going to go into it tonight. But all these agents all act in certain ways and have certain side effects. And we'll go through them in detail and tell you how that happens. Targets are a very interesting topic of conversation that divide endocrinologists. But just remember that they're all based on individual patient characteristics, preferences, potential side effects, and cost. And so therefore it's a negotiated target. So people living with diabetes, we start what their problem is, we develop a collaborative goal, and we validate their goals and plans. So it's no decision about me without me informing patient choice, because many of our tutors are primary care based, doctors and nurses, and they will all reiterate the same thing, that's all about a patient-centered approach. Why would that be? Well, the answer is very simple. You spend about 2 to 3 hours a year with a healthcare professional. As you know, in the last year, it's mostly been online. And then for the remaining 8,757 hours, they have to manage this complicated condition themselves, which is why we try to empower our patients. And we spend a good part of Module 3 explaining and helping you how to do and empower your patients. The language you use with patients is very important. 15 years ago, I might have been telling you about diabetics. That's not an acceptable term anymore. There are people living with diabetes. They have no reason to be stigmatized in work or by the medical profession. And it's very important that you take a balanced approach to them. We do teach you about emergencies. Everybody knows about hypo and hyperglycemia. Joanne worked in the A&E unit where you see people like this all the time. And this would be common emergencies and how to tell them apart. We'd like to think we teach you that very carefully. But remember, there are other emergencies as well. Joanne has moved to the treatment room, and this is the sort of patient that you might get into a treatment room any day of the week. Somebody living with diabetes for 15 years. They have, or perhaps their relatives have said there's something funny about your toe. And many of you looking at this would say, well, definitely there's something going on there. There's callus. They haven't been walking right for a while. Perhaps they've got peripheral neuropathy. That's red looking. Is that infected? But of course, your eyes drawn to this area, which looks black. It's very suspicious. And this is also an emergency, folks. This is a same-day referral to secondary care because you've no idea what sort of state that foot is in. You could have osteomyelitis, you could have septicemia, and certainly I wouldn't go poking there. I would get that an urgent referral. So that's another emergency that we teach you about. Of course, we teach you about the opathies, retinopathy, nephropathy, neuropathy, very important microvascular complications. That's Module 4. Module 5, I've just finished teaching tonight. It's all about large vessel disease, peripheral vascular disease, heart attacks, strokes, and again, a very important component of our teaching. We do focus a lot on albuminuria. I've been telling my students tonight about the importance of getting albuminuria, collecting it and getting it right. Because remember, you might have an EGFR of, say, 51, and then that would put you in that category. But if you have albuminuria, it increases your risk very considerably, and we'll be re-emphasizing this a lot, what an important marker albuminuria is. So I've given you some of the content. I'm now going to give you a very quick update on diabetes, breaking trials and updates. Well, you can't escape COVID. None of us have been able to escape COVID this year. And of course, unfortunately for people living with diabetes or metabolic dysfunction, they've done much worse. And then the other way round, if you're living with diabetes, COVID can precipitate acute metabolic complications such as ketoacidosis and hyperglycemia. Mortality is much higher in people living with diabetes, and that's related to hyperglycemia. but then the SARS virus can also precipitate type 1 diabetes onset as well. And then when it comes to mortality, just look at once your age creeps up beyond 60, you can see how much mortality and increases, and particularly in type 1s, which is slightly unexplained. But if you're an older type 1, then COVID has been very significant illness for you. Again, if you've got a metabolic dysfunction, if you've got hypertension or cardiovascular disease, then that needs intensively addressed, because again, COVID-19 people have done worse like that. Just a quick reminder about what's happening in the diabetes world, because SGLT2s that we use in the diabetes world are about to get a license separately for heart failure as well, which has been discovered completely by serendipity as part of the SGLT2 trials. The direct study, very interesting to study. Again, I discussed it with my students tonight, because we now know that if you achieve a greater than 10 kilogram weight loss, then your chances of going into remission with diabetes are very much higher, thanks to information we've gained from the direct study. And this is the Daily Mail. I know none of you read the Daily Mail, but it did come up with soup and shake diet on the NHS. So indeed, they're starting much wider trials of 800 calorie diets now in people living with diabetes. Folks, this is pretty much my working lifetime, and in that time the number of trials have increased exponentially, as has the guidance. And so therefore it's a complex area, but we take baby steps through it, so don't worry too much about that. But it's important that you know how these various agents, both traditional agents like insulin or sulfonylureas or metformin, and then the newer agents have evolved. The reason why they've evolved, there's been a series of ongoing trials called the cardiovascular outcome trials, and they've many of them are reported now and given us a lot of information. But very simply, the SGLT2s and the GLP-1s have by and large proved to be very effective in cardiovascular disease in people living with diabetes. In turn, that has informed the guidance. So now we have important guidance documents, the 2018 ADA ESD guidance, which was very quickly changed in 2019 to the current guidance. And then if you look at contemporary ADA guidance, then you can see there's these algorithms. Very simply, if you've got heart failure, you follow a certain track. If you don't, then you follow another track of drugs. If you want to get weight loss, you follow a track of drugs. And if the cost is the big indicator, then you follow another track of drugs. Let's take this one alone then. If you're living with heart failure or chronic kidney disease or cardiovascular disease, then the drugs are also set out in these algorithms. So my patient I discussed with my group tonight had chronic kidney disease, and the group agreed that she did indeed need an SGLT2. So people are following the guidance. So there we are, we've been through it. I've covered what the course gives. I've covered the world of diabetes. I've given you the key course content we cover. And then I've given you a very quick update on the management of diabetes as well. So why would you do the University of Warwick Diploma? Well, many of you would be living now or seeing patients with diabetes. You'll be very aware how that's all changing. I think you do have a duty to stay up to date if you're dealing with people living with diabetes. I suggest to you that the University of Warwick offers a comprehensive, convenient way to update your knowledge and skills. We have very high-class materials presented to you online. We work with you very closely to develop your knowledge and skills, as Joanne has told you, and we have a very high-tech platform to deliver with learning and motivation. So folks, sitting's the new smoking. You've been sitting for a wee while, but you're going to sit for a little while longer, because Dr. Dermot is going to talk to you now about what everything entails. Isn't that right, Dermot?
Fantastic. Thanks a million, Colin. So not to do death by PowerPoint, but I am going to flick over to my slides now, which hopefully you can see. I'm very conscious of time, so I'm going to go through this reasonably quickly so that we leave enough time for questions and answers. One of the first questions we always get is, who is IHEED? You will see the name IHEED beside the University of Warwick in practically everything that you do. We are part of the Cambridge Education Group in the UK. We were founded by a family doctor in Ireland in 2013. And effectively, what we've been doing for the past 7 or 8 years is working with ministries of health and healthcare regulators all over the globe, so Middle East, Asia, Africa, to build capacity, particularly in family medicine. And the way that we've done that is developed a really, really amazing online education platform specifically designed for medical education, and each program being designed by world-leading experts in medical education. We have, between short CME courses, master's level programs, and family medicine residency programs, we've got over 300,000 course completions on our platform in the last 7 years. So we are absolutely delighted with the amount of impact that we've had in healthcare education, but also in just the sheer global reach that has brought. The University of Warwick really doesn't need much of an introduction. They are ranked 8th in the United Kingdom. They're ranked 62nd in the world. So, it's very hard to get a more prestigious university on your CV. Warwick are, they're a Russell Group university, which is the group of elite universities in the UK that have a really, really strong research focus. And, Warwick has been at the forefront of diabetes education in the UK for the past 20 plus years. They've I think it's over 15,000 graduates now. In their diabetes programs. They are absolutely recognized world leaders. We worked with Warwick to not take a Warwick program and put it online, but to develop from scratch a very specific offering in diabetes that at its DNA is an online medical education program. And, Joanne said a couple of minutes ago, you can really tell the quality of that online experience has been designed in from the outset. So what the offering is, it's a 12-month postgraduate diploma that then leads into a 10-month Master of Science. And basically, you can enroll in a Master of Science from the absolute start and then exit with the diploma, or just keep going, or you can take a break for a couple of months and then do the Master. So there's a lot of flexibility in how you go through it. Warwick is recognised globally. What you get is a level 7 UK qualification. It's the equivalent for level 9 for anyone that's in Ireland. And that is recognised by health regulators for CPD, CME. It's recognised from the academic standpoint as well. And what we'll hope to give you a flavour of tonight is, I suppose, the quality that has gone into it. We've got Colin here. Colin is involved in the RCGP in the UK. He set up the Primary Care Diabetes Society. Dermot Quinlan was previously the National Diabetes Clinical Lead in Ireland. He's now the Medical Director for the College of General Practitioners in Ireland. Pam Brown is on the NICE steering committee for diabetes. She's the editor-in-chief of diabetes and primary care, and the list goes on and on and on. And I think one of the amazing things about this faculty is you're not just getting the faculty from one university. So people like Martin Hadley Brown from Cambridge University are on the program. We have experts from the University of Melbourne, from Malaysia, from Dubai, who are absolutely at the top of the diabetes game in terms of being able to lead and educate and have just an immense depth of clinical experience. So I suppose what does it look like and feel like to be part of this program? And again, these are some of the areas I was touching on with Joanne. So you'll be in a small group, and there's very limited spaces on the program. We take multiple groups, so we will take about 100 people onto the program every time, but we break those down into small groups. So you get to know your peers and you get to know your tutors really, really well, and it feels very tight knit. I'm going to go through the module structure in a minute, but the pace of the program it's just about right. That you get to do the postgraduate diploma, 6 modules in a year, and then you get to do the MSc professional project in 10 months. And it's just about the right amount of time of you get through it quickly, but it's not overwhelming. In terms of managing your clinical workload, and Joanne, I might bring you back in here. How did you find juggling, family, work, I was going to say social life, but not in the last year, and your study? How did you find that commitment?
I suppose what it does involve is a lot of, time management, and I suppose being organised, were two of the key things for me. At the time, I was still in acute care, so I was working night shifts, weekends, well, they say 12 hours, but 12 is really 13 and a half. So I suppose for me, it allowed me, I found that being well organised and having good time management, I suppose starting out the programme, looking at what your commitments are already and kind of setting, I used to have a kind of a timetable, I suppose, for myself as to when I would utilise my time to do the work that was involved, whether it's reading an article, whether it's maybe putting a discussion post together, doing some research for an assignment. And I found it worked for me, and it worked well. And as I said, it's not that you're required by a certain time to do things, in the sense that you can read your material in your own time, you can you can research your articles, you can do all of that in your own time. So it's about a good time management and being kind of organized and having a level of commitment. I suppose it would be unrealistic for us to think that those 3 things aren't important for you to be able to proceed.
Yeah, absolutely. And I think one of the most important things you can do is sit down with the people that you live with and say, right, this is going to be the commitment for this program, and it's going to be a couple of evenings a week, or it's going to be what, I'm going to lock myself away on a Sunday morning for a couple of hours to do this, and that you set that expectation. But I think and I was bowled over by what you're saying earlier. I think the support structures that are there are incredibly strong. There's a program management team. The tutors are amazing. You'll meet somebody from IHEED every single week on your tutorials. There is always somebody to ask a question of. And I think, in fairness, the university are very, to use a buzzword, student-centered. They always take the view of how can we support our learners? How can we help them to achieve what they need to? So in terms of the actual structure of the program, so focus first of all, well, by semester. So semester 1 is really giving you a really solid introduction into the world of diabetes. So we'll start off with things like screening and diagnosis, and effectively finding and classifying your patients, and the importance of evidence-based medicine. And each of these blocks represents one topic that you do in 1 week. So you've got 3 6-week modules. So we move from kind of the core principles into self-management, and you're very much looking at, okay, now that this person has diabetes or is in a pre-diabetes state, can you work with them? Can you use known tools and techniques to get them to modify their diet, their exercise, such that actually they, either they can mitigate complications, or, in the very best of circumstances, bring their diabetes into remission. And to do that, you need to understand how people behave and how they change and how they resist change and what motivates them, and to have evidence-based techniques to employ with them, the benefit of education programs, etc. We then move, the third module we move into is treatment. And this is, we won't discriminate between people with different scopes of practice. So whether you are a dietitian, a nurse, a pharmacist, or a doctor in primary or secondary care, we're going to talk you through the entire range of diabetes treatment, therapeutics. And our rationale is, one, the scopes of practice in this area are changing all the time. And two, the confidence that you get by understanding every aspect of it is immense. And as Joanne said, you if you're in a nursing role, if you're in a clinical role, it doesn't really matter. You're going to end up being really involved in treating the patient as a whole. So that's our first semester. That is approximately 6 months, so 3 6-week modules with sensible breaks in between. The second semester, then we get into the management of complications. So small vessel complications, so eyes, feet, kidneys, etc. And then the fifth module on macrovascular complications really is, we've a heavy focus on cardiovascular risk prevention in that. And then we finish off the kind of the taught component of the program, looking at some of the more topical issues like gestational diabetes, like there's such a link between mental health issues and depression and diabetes. People that are fasting, people that are that are doing arduous sports. They're back in the days when we could travel. If someone's traveling 3 or 4 hours east or west, what does that do to their regime? So lots of kind of very, very practical situations that people will be in. And what you can see from these modules is, you're following the patient journey. So you're starting off by finding your patient, then you're helping them to change, diet, lifestyle. You're going through all the drug treatments that are available. You're managing the complications that arise, and you're dealing with them right into later life. So you get a really comprehensive, really, really in-depth, patient-focused view of diabetes. We then move into semester 3, which is the master's level. And this is a professional project where you choose an area that interests you, that is novel, that can add something to the body of literature in diabetes, and you carry out a project to research that. And we go right from choosing the research idea to getting ethics approval, collecting your data, and then writing up your manuscript. What I think is particularly innovative with Warwick is they don't ask you to do a 15,000 word dissertation. What they ask you to do is actually boil it down into a research article, do something that is of value to the community that you could actually go and get published. So you do a research article that's worth 80%, and you do a conference poster presentation, so that at the end of your master's, you've got all the same research skills, but actually you've got something really tangible that you can take from the program. So we think the curriculum is really innovative. It's really patient focused. It's all about clinical decision making. It's based on the very latest evidence, as Colin has outlined, but really the focus is on what do you do with the patient in front of you. So in terms of actually how it works, then you get a really comprehensive online orientation. And most people will not have done online learning in this way before. We make sure you're really comfortable with the platform that we use, really comfortable with the supports that are available, with the structure of the program. So that takes place over a week. And then after that, each following week kind of follows a pattern, and we fall into a rhythm of, you'll contribute to a case vignette. So we'll give you a case scenario and ask, what's the next step in diagnosis, in management, in escalation and intensification, etc. And you contribute to that at your own pace during the week. You then go through the online content, again, completely at your own pace. And this is, and it's very hard to demonstrate this on a kind of flat screen here, but this is some of the best clinical content you will see anywhere online. It's written to be really, really engaging, really, really interactive. There's quizzes, there's reflective pieces, there's lots of video content, there's lots of animation in it. It is not reading kind of pages and pages of flat text. And then towards the end of the week, then you come together on a Thursday evening in Europe, a Friday morning in the Middle East, for your weekly online tutorial. And that is you with your group of 20 discussing that week's topic. And that's, that's with Colin or one of the other faculty. And it's really bringing the content to life and having a discussion about, well, in relation to, retinopathy, how do you deal with this in your clinical setting, and having a very real conversation about it. There is, of course, assessment, and the assessment for the program is an essay at the end of each of the 6 modules, and then an exam at the end of the semester. The pass rates are extraordinarily high. They're above 90%. Everybody coming onto the program is clinically qualified. You have a really outstanding education experience, really strong support, an amazing faculty, and the assessment is fair. And with that in place, then you expect you expect the program to perform well. So we've had over 500 students, 88% student engagement, and that I think that speaks to the reality of being a full-time clinician and a part-time learner, that nobody is going to make 100% of it, but you'll get on absolutely fine, even when you do miss a couple of things. The feedback we get on support is it's embarrassingly high. It's fantastic to see, but there are people like my colleagues Ian and Terry that they go out of their way to look after the people that are on the program. And you can see there the pass rates are high. It's because of all the inputs into the program, not that it's particularly easy. What I'm most proud of, though, is when we do the pre and post surveys, the confidence levels, and this is a series of questions asked on a 5-point scale of how confident you are in carrying out various aspects, and you can see it goes right from kind of some level of confidence right up to practically 100% for some of these. And then, some of the areas are difficult, like helping someone overcome obesity. That's always going to be a challenge. Emotional distress in a young adult is always going to be a challenge. But, the things around, drug initiation, around knowing what to do and when to do it, off the charts. And then we went back to the group last year. We went back to the group that qualified in 2017. And we said, right, you're 3 years out. What has this program actually given you? And they were asked again on a scale, and what you're looking at here is the responses of some impact or a large impact. Patient care, career, reputation with colleagues is huge. And I think one of the benefits coming off this program is, irrespective of the particular discipline, which in this case is diabetes, you will get very comfortable with evidence-based medicine, with research, with being able to interpret clinical trials yourself. You won't be waiting for someone else to interpret it for you. So let's go on to kind of some of the practicalities then of joining the program. So the entry requirements are, we'll say evidence of proficiency in English language. That is not a formal IELTS test or something like that. It is, we get that from the personal statements that we ask you to give us in your application, and we get that from conversation as part of the onboarding process with our education advisors. You do need to be involved in a clinical role during the program. This is a patient-focused program, and it's very hard to put it into practice if you're not actually seeing patients with diabetes. And the kind of the base level of academic qualification to come in is a health science degree. So we'll ask you for a copy of your degree. We'll ask for the personal statement. We will ask you for an employer or an academic reference letter, and all that is saying is you're a clinical professional in good standing, and we'll ask you for photo ID. There are limited places available. That shouldn't say November, not March or October. So we cap the places every time. We keep the group sizes low. And then the question, if it has been asked in chat, it will be soon. It always is. So in terms of the pricing model then, so if you are doing the Masters, it is £12,000. If you're doing the Postgraduate Diploma, it's £8,000. And similarly, if you exit below that at the cert, it's 4. So you've got vast majority of people will go on and do the masters. About 40 to 50% will exit at the postgraduate diploma stage each year. There are early registration discounts available. So until the end of this month, if you register early and if you pay early, there are very substantial discounts available. The program is eligible for Student Finance England funding as well, and the code is on the screen there. When it comes to paying your fees, you can pay in bulk, you can pay by semester, or you can pay in monthly installments as well. So there's a degree of flexibility in how you can do that. These early registration discounts are there to be availed of. So if you are interested, deciding early has significant financial benefit to you.
Just sorry to intervene there, Dermot. Just to be very clear, this is the full payment for the program, not the per annum price. Obviously, as a Russell Group institution, most comparable programs at postgraduate level will be at least 20 to 30,000 sterling. So it does represent a genuine, very significant, achievable fee base. And obviously there are supports with the CCGs, with the trusts, with Student Finance England, and in Ireland with the voluntary hospitals for nurses in particular. So there are supports, there are funding mechanisms that you can also leverage, but it is, in terms of Russell Group and comparable pricing, we are doing everything in our power to make it equitable and fair and achievable for clinicians.
Yeah, absolutely. There is a recognition of the prestige of Warwick, but there's also a recognition that the programs need to be accessible. So the Warwick have been brilliant about setting the pricing fairly. So I'm gonna wrap up, Rebecca, and move on to questions. I suppose in summary, as I said, I think the beauty of this offering is you can get through this level of a program by utilizing a really strong online environment, generally at about 2/3 the pace that you would with any other qualification. So time-wise, you can do a postgraduate diploma in 12 months, you can do a master's in 10 months following that. Next intake is in October. This will be oversubscribed. It will fill. It does every time, which is fantastic. But if you are interested, I would suggest applying earlier, especially with those discounts available. Warwick, they're 8th in the UK, 62nd in the world. They are such an amazing university and so supportive. I think the recognition that the qualification has is phenomenal. There's a huge history of diabetes with Warwick. It's recognized worldwide. I think the part-time nature. It's what I don't think we've gotten across tonight as well as we could is it's ran by a bunch of very approachable, friendly people who really want to support you. The back and forth that you'll have with your peers is fantastic. It is, in as much as an academic experience can be, it is fun. You're learning about something really interesting that has genuine impact, and you're doing it in a really enjoyable way. So I will stop screen share here and see what has been happening on chat since I've been
just before we do Q&A, sorry guys, I'm just doing my last exit poll. I'll run it very, very quickly because I know you're all tired of listening to us. So I will just do it very, very quickly. So apologies, I'll just get it up for you now. This will just take a few minutes. It's just to follow up on if you are interested in this forthcoming intake or an intake perhaps in 2022 and how you'd like to be contacted by us, and essentially if you were happy with the information received today. It really helps us understand if you need an immediate reach out, if you need an immediate assistance from our team of education advisors, and they'll be able to prioritize you based on if you're starting on this intake and if you have a particular communications preference. So it is important for us because it'll help us make sure that we support you in I suppose, considering this program and then progressing to application if you do wish to proceed. So we'll try and get to the 70% again. We're at 47% at the moment. So thank you. We'll push it a little bit further. And the education advisors, we have a whole team of student counsellors and learner counsellors that can reach out to you post-event. This will be sent to you by email, this recording, and also the application link and the deposit link. But in addition to that, you will get a phone call from an education advisor just to ask you if you have any other questions and if you'd like to proceed to application. So they're very knowledgeable, and they will really help you, particularly with the payment plans that could be a bit confusing in terms of monthly installments and how you'd like to pay. So they will be on hand, and they will reach out and contact you post-event. So still at 56. I'm conscious I don't want to keep you guys waiting. So
let's leave the poll open for a second, but we'll start to answer some questions. So a couple of things that have come in on chat that I might just talk to. So someone looking at gestational diabetes, absolutely. It's a really important part. You'll cover that in a specific way in module 6 on that, but you'll end up covering it in the drug treatments module. You'll end up covering it in the self-management module as well. So there's areas that have a direct focus, but then there's bits that are kind of peppered throughout. The certificate, and it's a really good question. So the certificate will be a University of Warwick postgraduate qualification, be it the postgraduate diploma or the master's. It is the exact same as any other qualification that you would get from doing a campus-based face-to-face program in Warwick. It doesn't mention online, it doesn't mention IHEED. It is simply a University of Warwick Masters in Diabetes Care. Has the exact same standing as any of their other qualifications. There is literally no difference between them. The other question that came in then on tutorial timing. So those weekly sessions, if you're in Europe, they're on a Thursday evening, usually 7, half 7 in the evening. If you are in the Middle East, they will be on a Friday morning. And sometimes what we get is people in Europe saying, actually, you know what, a 7:30 a.m. Friday morning tutorial would actually suit me better. And they go into those groups. If you are in Asia Pacific, it is evening time on a Thursday as well, which is lunchtime over here. Again, you get odd smatterings of people going into different groups. The tutorials, everything is recorded, everything goes up on the platform and is available to you to watch afterwards. So if you miss one of those tutorial sessions, it's going to be sitting there within a couple of hours waiting for you, and you can watch it whenever you want. Joanne, question for you. Did you get any, well, you won't have gotten NHS funding, but chat away.
No, I suppose to answer the question, I had worked previously for the NHS. I don't work for the NHS at the moment. I do know there was a lady that was on my programme that had, obviously she was a nurse, and I do believe she did manage to get, I think, some funding. It's worth kind of going onto the NHS website, and if there's somebody you can contact about funding in relation to that, there's actually a specific department within the NHS that deal with funding out, especially if you work in an NHS hospital or if you work for an NHS organisation in the UK. Also your direct employer, so if you go to your ward manager and such like that, a lot of wards will have element of funding that's given to them for programs as well, especially if you're going to obviously be of benefit back to the
and
hospital.
just Joanne,
there's usually a
just to add to that, if you are in primary care rather than secondary care, if you go approach your PCN clinical lead, or if you go directly to your CCG, they also have a professional education budget, so you can approach your CCG as well in primary care.
Yeah, absolutely. Colin, there's a question come in. We've spoken a lot about type 2 tonight and about kind of behavior modification and things like that. Type 1 diabetes.
Yes, so we do cover type 1. We don't have a specific section for it, but it runs as a thread through the 6 modules. We cover insulin in quite a lot of detail. We cover it in aspects of travel and sport. I think we do cover it quite well. We cover it in terms of cardiovascular risk, microvascular risk. So there is cross-cutting themes, although it's fair to say that in quite a lot of the drug treatments, we do deal with type 2 quite a bit. But yes, type 1 is very well covered, I think, in quite a lot of aspects, including monitoring and the new approach to monitoring and all that sort of thing. So I believe it is covered very well, Dermot.
Yeah, no, absolutely. And I'm reading back up to one of Katarina's questions about, she's an international GP and looking, wants to do diabetes consultations in her practice. And I think this is exactly what the program is trying to set people up to be able to do, is to
Absolutely.
manage your patient as much as possible in a primary care setting. That is, it's better for the patient, it's better for you as a physician, it's better for the health system. It is exactly that's the aim of the program.
Mary Jane wants to know when we start. Is it the third week of October, Dermot?
Yeah, the 24th of October is the
24th, that's
induction week.
induction week. Yeah.
That's induction week. So we'll spend a week going over, how to use the platform, the program structure, the supports, the timetable, everything like that. And then we get into week 1 of module 1. So we'll do module 1 this side of New Year, and then there's a break for New Year, and then we're into modules 2 onwards then in 2022.
Dermot, Patience has a question about a certificate in diabetes care. I think she would need to do the diploma again, wouldn't she, Dermot?
Yeah, so that the certificate in diabetes care from Warwick is it is an undergraduate certificate. It's a really nice course. It's a really, really nice course, but it is certainly not at the depth that this program is at. So no. It's a very good feeder into it. But yeah, it's you would start and do this program in full. But with a very good foundation.
Yeah, it'd be a really great help, but you would need to do the diploma and then move. And certainly if you wanted to do a master's, you would have to have the diploma as well.
Yeah. Rebecca, what else have we missed, or have we caught most stuff on the chat?
I think the guys have been great at keeping on top of it and answering chats as we go along. So I think we've caught most of it.
Brilliant. Yeah, I mean, as I said, it's we're amazed at this program. There's been 500 people on it over the last couple of years. It fills every single time. The autumn intakes are usually a bit more popular as well than the spring intakes. So if you are interested, chat to the education team over the next couple of days, and they will happily answer any questions that you have and clarify anything for you. And yeah, I think, Colin, we would, hope to see a bunch of people from on the call, on the program.
Absolutely.
Yeah.
And just guys, it's just because it's an online program does not mean we just enroll. We do cap by region. So there is limited spaces available. And as Dermot said, October, particularly in Europe, is the more, I suppose, popular commencement period. So it's more popular than the spring intake. So if you are interested and want to apply, I do advise you to go ahead and apply early and pay your deposit early to secure your place. Yeah. You'll get the email out tomorrow, which will have the recording of this event and also an application link and a deposit link, and you will get a reach out from one of our education advisors thereafter.
Rebecca, I know we're over time. I was going to very quickly answer the 2 questions that came in. So where do you write the exams? And that's something I didn't talk about. So you do your exams online. They are supervised remotely online, but you do them sitting on a laptop in a room. We verify that you're in the room on your own, that you don't have notes plastered on your wall. Then off you go. And you've I think it's a 48-hour period that you can just choose when to sit your exam. So there's a ton of flexibility in that. Qualifications, yeah. So there is it's your undergraduate degree is the normal qualification that you need. There is a route for nurses that hold diplomas in nursing that don't have a degree, because for a long time that was not the career path. So Warwick, again, very pragmatic around that. So have a chat with the education advisors and they'll walk you through all of that. But yeah, we have about 50% on the program of nurses. So it's about 50% 50% nurses, 50% doctors, yes. And then 10% a mix of everything from pharmacy to cardiology to you name it.
Can I just share one thing? I just want to say one thing about the program. I suppose if we think back traditionally when we studied before, when we go through degrees and stuff, there's always maybe an element of the program where you kind of step back and think, God, like, what am I ever going to use that for? Sociology or whatever. And it is important. What I would say about this program is every module and every week you study will have some impact on diabetes, and it is information you will use. It's to understand, like, it's amazing to see that every week has a value to actually learning about diabetes, and that there probably isn't one thing that I've come back from a tutorial kind of going, what am I ever going to use that for? Every week there was something, and you will use something from every module that you will do, especially when you have and directly looking after patients with diabetes. And it will all have an impact on care. It will how you view diabetes from even a sociological perspective, and understanding, even things like screening, where we often think, why don't they do that, or why do they do this? So for me, I would like just to add that as well. From the program content itself, every kind of week that you do has value. Whereas, like, sometimes when we've studied before, we kind of think, you've done a module and you think, well, that's done now, I don't think I'll ever see that again. But on this program, you utilize everything that you will use and study.
Top that as an ending.
I promise we didn't pay Joanne a gratuity for her presence today.
No, they didn't. I still have to pay my fee, so it's okay.
Thank you, guys. It was just a pleasure having you all on this evening, and you get the recording tomorrow.
Thank you so much, everyone, especially Joanne, Colin.
No problem.
Thank you so much for contributing. Brilliant session.
Take care.
Nice, everyone.